The majority of kids certainly, I think, have been deprived of a very important engagement with their teachers, with their classmates, and the academic discourse that's very important for consolidation of knowledge. Certainly, I think it is the neurocognitive, psychosocial, and overall behavioral health that we're seeing that transcends all age groups, from infants to toddlers to children to adolescents to young adults. We have found that COVID-19 as a disease has been fairly benign for the most part for children and healthy adolescents. However, the effects on our youth have been profound and should not be underestimated. And we need to, as a community, as a society, be very mindful as we look to manage and eliminate this terrible disease. How can we keep these in mind as parents and as caregivers for our youth? Well, with lack of youth sports and with most folks having their children learn at home, children have not been moving around as much as we normally expect them to. And with access to food at home, we have seen a tremendous number of patients with overweight and obese changes in a very short period of time. We've also seen, in the absence of sufficient outdoor activities, so to speak, we've seen an absolute epidemic of vitamin D deficiency. In our infants, we have seen some children with delayed speech in that period due to deprivation of normal experiences, contact with other children and adults. We've seen in other age groups, certainly in toddlers and young children, we've seen social anxiety. We've seen social awkwardness. We've seen some patients who have regressive behaviors in childhood, like bedwetting, a lot of psychosomatic symptoms like abdominal pain or headaches. Certainly in our adolescents, we've been very concerned with the rates of major depression and anxiety. Certainly in extreme cases, we've had more suicidal patients during this period than we've had in the past. Every slice of these children's age group has been affected in some way. That's complicated. Some children, a few of them, have really thrived being able to learn at home within their comfort zone and with the tools they would like. But the majority of kids certainly, I think, have been deprived of a very important engagement with their teachers, with their classmates, and the academic discourse that's very important for consolidation of knowledge. Well, one of the things that's very important is to not underestimate the value of vaccination. For your youth, 12 and up, vaccination is safe and effective and will help increase the confidence for you as a family to get your life back on track. And part of becoming back on track means going out, seeing people, seeing family, seeing friends, going to places to improve your self-esteem and to improve your joy and to increase the opportunity for those kids to, again, expand their horizons all over again. Well, certainly one of the things is to get the wheels turning again. So reading, puzzles, math problems, it's incredibly important for children to enter the school year with their minds prepared to learn again. And simple things, even reading for fun, go a long way. It's also very important that they have adequate sleep, they're on a routine, they have a good schedule, and their bodies are physically well with a good healthy diet and some exercise.